Hello, my name is David Pena, and today we'll be discussing Module 5, Victoria Exercising. So Victoria has begun to exercise, and we are going to discuss some of the changes that she will encounter internally and externally, as well as the benefits that there are to gain from exercising. What are the cardiovascular changes taking place as Victoria jogs? As Victoria jogs, her respiratory rate will increase to meet her high demand of oxygen, which will then cause the cardiovascular system to increase the cardiac output. This causes increased heart rate, increased cardiac output, increased blood pressure, widened blood vessels, increased body temperature, and increased oxygen to the muscles. How do you expect your heart rate to change? Why? I expect Victoria's heart rate will increase. What is the purpose of this change in heart rate? The purpose is to increase the heart output of oxygenated blood. This will supply the muscles used when jogging. Which division of the nervous system governs these changes? The autonomic nervous system. How is the status of her blood vessels at this moment? At this moment, Victoria's blood vessels are vasodilated. This is because vasodilated blood vessels allow for faster blood flow. The primary blood vessels affected by these changes are the capillaries. What do you think is the status of the precapillary sphincters at her quadricep muscles as she jogs? The purpose of the precapillary sphincters at Victoria's quadriceps are to open. This is because jogging would require the capillaries to dilate and increase the blood flow. Victoria's face has turned red. How do you explain this phenomenon? While exercising, Victoria's blood flow has increased, which has caused the capillaries in Victoria's cheek to become dilated and therefore causing the red appearance on her face or on her cheeks. How does the blood volume redistribute in the body at this time? The blood volume redistributes in the body during exercise in order to provide the necessary blood flow to all areas of the body that are being used when jogging. The priority organs that will receive blood flow are the brain, the heart, and the pulmonary system. The non-priority organs are the kidney and the gastrointestinal organs. Regarding the nervous system, what division of the nervous system is causing these responses in the heart contractibility, heart rate, and blood vessel diameter? How? Again, the autonomic nervous system and the intrinsic conduction system are causing these responses. This occurs through the SA knob and the VA knob, the atrioventricular bundle, and the Purkinje fiber. The neurotransmitters that are being released in greater proportion are the epinephrine, the norepinephrine, and the cortisol. What about her respiratory rate? Victoria's respiratory rate will increase. Her breaths per minute, or BPM, will vary when exercising. The standard BPM when not exercising is 15 beats per minute. The exercising BPM can vary between 40 and 60 beats per minute. How has the rate and pattern of the respiration changed? Why? The respiration rate increased and the pattern is more frequent during exercising. This is necessary to keep up with the demand of oxygen that is needed for the system and the muscles to function while jogging. What changes do you expect to see in the diameter of her bronchial tree as she jogs? Bronchial constriction or bronchial dilation? I expect to see bronchial dilation because there will be an increase in demand to provide more oxygen to the blood. The type of muscles that are responsible for the changes in diameter to the bronchi are smooth muscles. Smooth muscles are located in the main bronchiole, up in the respiratory bronchioles. What division of the nervous system is stimulating these responses in the bronchial tree? The sympathetic nervous system is stimulating these responses in the bronchial tree. Describe the benefits of regular exercise in mental health and in other organ systems of the body. The benefits of regular exercise to the muscular system are an increase in muscle strength and muscle tone. The benefits on bones, such as the osseous, are the bones will be strengthened. And the benefits to mental health are the body will release endorphins when exercising, which will decrease anxiety and depression. I'm going to describe and show how to palpate the superficial arteries covered in this course. So why should we only palpate one of these arteries at a time? Only one artery should be palpated at a time to prevent cutting off the circulation to the brain. So to start off, the common carotid artery, place the fingers on the medial anterior side of your neck, right about here. Next, the brachial artery, place fingers on the anterior antecubital region. So right here, right about here. It might vary a little bit depending on you. And then the radial artery, place fingers on the lateral carpal region. So, sorry, use this instead. Right about here. Sorry. On the outer, a little bit on the outer side of your wrist. And then next I have the femoral artery, which you're gonna have to place your fingers under the hip, lateral to the pubic symphysis or symphysis. So it's gonna be like right around here, right underneath the hip. It's a little bit hard to get in there. So I'm just gonna kind of show the diagram probably shows a better description of where it is as presented. Next I have we all have the popliteal artery. You place your fingers on the posterior side of your knee. So your knee, sorry, you're gonna be like right underneath here. That one might be a little bit difficult for a lot of people. You might have to be kind of skinny to get to that one. Myself, I can barely feel that one. And then the posterior tibial artery, where you place your fingers between the medial malleus and the Achilles tendon. So again, you're gonna place and right here. I apologize if it's kind of hard to see. It's and then last but not least, the dorsalis pedis artery, where you would place your fingers between the hallux and your first phalange, and then you would go up towards your metatarsals. That's another one that's a little bit difficult to demonstrate, but I will do my best. So, apologize. See my foot between my hallux, my first phalange, and I would go up around right here. I apologize if it's difficult to see. And that will conclude my presentation. Thank you so much for your time.